everyone, आज का बहुत स्पेशल टॉपिक है about youthful face, how to make you feel and look young. So, I'm Dr. Diksha Dixit and I have with me my dear colleagues and friends, Dr. Shreya Krishnan, who is a maxillofacial surgeon, and Dr. Heena Kudyar, who is a plastic surgeon itself. We are a team Aesculpir and आज हम तीनों gather हुए हैं to give you an insight of how we work, plan the patient together, discuss what can be best done for the patient, and give you an insight on how, after discussion, we plan out a protocol for you so that we give you your desired looking result. So आज हम बात करेंगे पहले how to have a youthful looking young face. So I have with me Dr. Shreya Krishnan and Dr. Heena Kudyar. Hello.
Hi, good morning.
Hello. So starting with the topic, हम डिवाइड कर रहे हैं यूथफुल लुकिंग फेस को इनटू 3 पार्ट्स. पहले हम नॉन सर्जिकल ऑप्शंस के बारे में डिस्कस करेंगे, which डॉक्टर हिना विल डिस्कस, and then we will move on to the surgical options. Now surgical options we are again dividing into the bony element and the soft tissue element, जो कि bone के ऊपर के soft tissue part को कैसे हम modify कर सकते हैं. So for the bony element, Dr. Shreya will describe you, and the rest surgical soft tissue part I will be the one describing and discussing with you. So first let us start with the non-surgical or the minimally invasive options we have to enhance your face. Over to you, Dr. Heena.
Thanks, Dr. Diksha. So, hello friends. I think Dr. Diksha has very well explained that youthful looking face में we have multiple options. We can divide the options into non-surgical, surgical, then soft tissue and bony. So, I think starting with the minimally invasive and the non-surgical procedures which we have with us, and how we can enhance the aesthetics and proportions of the face with all these non-surgical procedures, because there are many patients who come to us and they don't want surgery. Even if we want that they should undergo a surgical procedure, they don't want to undergo a surgical procedure, and they're always looking for a non-surgical option. So non-surgical options, we have many options, like starting with the injectables, which are Botox and fillers, then the threads. So I'll just talk in detail about how all these can be combined together and how they can enhance the facial aesthetics and give you a young and youthful appearance. Now the Botox, as we all know, it's botulinum toxin and it can be used to treat the wrinkles, जो कि बहुत commonly everybody, I think every person knows कि whenever they form the wrinkles, we should go for Botox. But this is not the only indication. I think Botox, which according to us, जो हम use करते हैं for enhancing the facial features, we can use it for brow lift when we give Botox over the forehead. So it lifts the brow, and it is also known as the chemical brow lift or the non-surgical brow lift. And then it can also be used to debulk the masseter muscle, which sometimes is which gives a very masculine and broad appearance to the face, and in fact the jawline also appears broad. So Botox can be used for debulking the masseter muscle, and it gives a very good definition to the jawline. Then the second injectables which we have with us are the fillers. Now fillers, mostly people think that there is loss of volume and we should go for fillers. But according to us, we can use fillers to enhance the aesthetics of cheekbones, then nose, lips, jawline. All these facial features can be enhanced with the use of fillers as well. Same is with the threads. The threads can also be used to lift the brows, then for lifting the mid face, and then neck lift, the jawline definition. All these non-surgical procedures, they can be combined together, and in patients who don't want to go for surgery, we can use them. But then again, some add-ons are also there, like the surgical devices, radiofrequency, ultrasound devices, chemo exfoliation procedures, so that they can also be combined, and they work as add-ons for giving a youthful and rejuvenated face to all the people who are desirous of these things.
So Dr. Heena has rightly said. I would further like to add on to this before going ahead with the discussion, that these kind of procedures are very well known amongst the younger population and the older generation as well. many patients, both young and old, they come with us having a picture of a particular celebrity that he or she wants to look like that and feel like that. You know, they want a facial contouring like that. So here we would like to tell you that these celebrities, they undergo lot of non-surgical and surgical procedures as well. So it is very important. The point of discussion here is to make you aware of what all procedures are available to give you your desired result. So you can combine both non-surgical and surgical as well in one go to give you a desired result. But at the end, every face is unique. You need to sit with your expert, discuss with your expert what maximum can be done for you. So this was majorly about the non-surgical part of enhancing your facial aesthetics, so to help you look youthful. The next part comes the surgical option. Now in surgical, as I told you, we've divided into the bony framework modifications and the soft tissue modifications. So I have Dr. Shreya with me, who is going to discuss about the bony modifications which can be done to give you your youthful appearance back or give you a fresh looking face. Over to you, Dr. Shreya.
Thank you, Dr. Diksha, for the wonderful introduction, and Dr. Heena for telling everything about the non-surgical treatment options. I think every patient, when they come, they have it in their mind that they'll only go for non-surgical.
Yeah,
but when we sit together, we realize that not every case can be dealt with in a non-surgical manner. Now, the end goal of the non-surgical treatment was to give the face more lift and more tightness. That can be achieved mostly and a lot of times with non-surgical options. However, without enough skeletal support or without enough bony projection, it is not necessary that these procedures will work in cases where there is deficient cheekbones, deficient gonial angles, deficient chin. So in these cases, which of course we analyze once you come to us and we sit together just like this, so we are giving you a sneak peek about how we treat every case. And when we come to the conclusion that such and such patient would benefit with enhancement of the bones, this is when we consider these hard tissue surgical options. Now, what are these hard tissue surgical options? Let's say a patient is feeling sagginess or bulkiness or looseness on their middle part of the face. Then we analyze whether the patient has very flat cheekbones or not. Even though it is conventionally understood, women want prominent cheekbones. However, you'll see males also want that if they want tight mid-face. And in these options, in these cases, what we do is we plan cheekbone implants or cheekbone enhancement by specifically treating a patient as an individual. We don't, we in our practice with Team Aesculpir, we have stopped going in for we've stopped going in for stock implants. We plan every case, we take the measurements of the patient's bone, we feed it into a computer data, and we 3D print all our cheekbone implants, and that has become the standard of practice for the past 2 years now.
Yes.
A lot of patients have benefited with completely customized solutions for their hard tissue enhancement. So that is about the cheeks, and once this is done, the cheekbones come out, the skin of this area becomes tight and lifted upwards. Moving slightly lower, the chin and the gonial angles also benefit from enhancement procedures. Gonial angles again can be implanted just like I described for the cheek by customized implants. The chin has more options. The chin we can play around and we have more freedom with the chin, because if a chin is small and protruded, we do a sliding rhinoplasty, we can attain advancement and projection beyond sometimes even 1 centimeter, which is a lot for the patient. Even 1 centimeter advancement, you will see your neck will look better, your face will look better, your cheeks will look better, your smile will look better. So it's a very, very gratifying procedure, the chin. And of course, you look younger by almost 10 years. So, combine any of these procedures and choose the case well. This is our motto, and we always underdo. I think that is our motto.
And I think most of the times the patients are not aware about their retuded chin. They come for other procedures like fillers, for lip augmentation, but they are not aware that it's the chin which has to be corrected, and then I think we can plan and then discuss with the patient what is to be done and what is best for him or her.
So here the role of an expert comes into play, which is very important to let you know that whatever you are asking for or whatever result you're wanting, that is not directly by an interplay of the tissue which you are wanting to change. It may be because of some other deformity which you are not aware of, or some other correction is required so as to give you that look on your face. So please sit with your expert, discuss your doubts, and then come up with a solution and be in sync with your team who is working on your case, so that you go ahead and experience your have a fulfilling experience.
It's true.
Yeah. So she's rightfully explained about the bony abnormalities or the corrections that can be done to enhance your look. Now, once we have evaluated that there is no bony framework or what all bony framework changes we need to know, and still we feel that in spite of bony framework we require additional procedures to enhance your soft tissues, or if there is soft tissue deficiency as well, to contour your face. So हम specific operations plan करते हैं. We can either do it by in the same sitting with the bony framework changes, or we stage the procedures that once the bony framework procedure is modified, wait for some time, see the result, and then go ahead with any kind of soft tissue changes which are required residually to be done on your face to give you a very youthful V-shape look.
Absolutely.
So coming to those soft tissue surgical procedures, I start from top to bottom. There are many patients who feel that their eyebrows are drooping. So for them, there is a surgical eyebrow correction, which we call as brow lift, which give tiny incisions inside your hairline to lift your lateral part of the brow most of the time. This is fairly an office procedure. Per patient can come, get it done, and go. You don't need to get admitted specifically for a brow lift. Again, then there are surgeries for eyelid. If after evaluating this, we feel that your eyelids are droopy, you feel tired, you have deep grooves beneath your eyelids, that can be corrected by eyelid surgeries. Now, eyelid surgeries, chiefly the upper eyelid and the lower eyelid surgeries, are known as blepharoplasty in our terms. We correct the loose hanging skin and sometimes the droopy brow also with the eyelid surgery. For the lower eyelid surgery, we can correct these deep teardrops, we can correct the loose hanging skin and give you a fresh looking face. And the correction of deep teardrops can be done by fat grafting as well if you don't require a filler. Then again, rightly, Shreya has mentioned that cheekbone enhancement can be done by custom-made implants. Even after that, if you want more contouring or more highlighting of your cheekbones, which are the malar bones, we can correct it by giving you fat grafting as an option. But then again, we do it after analyzing whether that much enhancement will help or will suit your face or not. Then again, coming to the lower part, if we talk about the lower part of cheek, usually after bony correction, much is not required in terms of soft tissue enhancement. What you require is a hollowness below your cheekbone, for which we can sometimes remove your buccal fat or deep fat part which is around your oral cavity or your mouth, by giving incisions inside the mouth and taking out the required amount of fat to give you a chiseled look. If you take out more fat, it might give you a very hollow looking and a shriveled and an old looking face. There, the expertise of our surgeon lies as to what adequate amount of buccal fat can be removed to give you a good chisel look. And once you have a little bit of hollowness, your cheekbones will be enhanced and your jawline will be enhanced as well. If we go to the lower jawline, it is chiefly the bony correction which helps you give you a good chisel jawline. Then in the neck, we have options of enhancing by doing liposuctions or by giving deep incisions in your chin line to give you a neck lift, so that you have a tight looking neck which enhances your lower part of face and your neck as well and give you a good definition of jawline. Apart from that, if a patient is old enough and you feel that bony corrections or non-surgical options are not there for her, then we give them an option of a proper facelift so as to enhance the whole part of mid and lower face in one go along with the neck. So this is chiefly an overview. Yes, I have missed two more prominent things, that is the nose and the lip. Nose, as one ages, nose droops a little bit because the ligaments become lax, the supporting structures become lax, it might become boxy, you might feel that the nose is broadened with time with age. So for that, we can go ahead with a nose job or a rhinoplasty to correct a little bit of deformities which are required. Or with over time you feel that your bone has become prominent which was not there because of the thinning of your skin. So that can be corrected by a nose job or a rhinoplasty. Now if we come to lip, as we age or in certain patients, your vertical lip length of the upper lip lengthens with time because we are used to using our mouth daily for every purpose. So in that case, we can either we assess whether a lip volume enhancement is to be done, or we have to uplift your lip as a whole. For that, I think we assess the vertical lip length and then suggest the patient whether you want a lip lift or you want a volume enhancement, which can be in terms of fat grafting or fillers. That's majorly about the surgical options and the non-surgical options to enhance your facial aesthetics. Now these things have to be combined, sometimes non-surgical and surgical as well, to give you your desired look. Sometimes we have to sit as a team to help patient assess and evaluate and come to a final conclusion ki what is his or her priority to get that look and help them achieve that look. So it is the teamwork which is very important, and comprehensively you can evaluate and plan the best for you. So know your team well and sit with your surgeons well beforehand so that you are in sync with them before the surgery and you are happy after the surgery as well. So I think we will conclude here. And if you have any further queries regarding any facial aesthetic procedures and you want us to elaborate more on that, please feel free to write to us. You can follow our YouTube channel for further updates and related videos. You can also subscribe to our Instagram handle by the name of Aesculpir, and surely can contact us by the numbers given below. Thank you so much.